Yeah, okay. Shall we start?
Yes, yes.
Yeah, everyone, namaskar. Today, we are starting our first PG-oriented program on virtual platform of this calendar of year. I welcome our chairman, Dr. Naaz Jahan Shaikh, for today's program, and I request her to conduct the program. Madam, please.
Yes. Good evening, everyone. Respected dignitaries present for today's meeting. Secretary Dr. Sarvesha Raje Urs, past President Dr. H.V. Shivram, our President-elect Dr. Rajshekar Jaka, past President Dr. past Chairman Dr. Tanga sir, then all the executive committee members, Dr. Preeti, Sunil, Anand Ravi, and all the members. And today's speakers for today's program, Dr. Lakshman and Dr. Ramakrishna, heads of the department of various institutions, and all my dear postgraduate students. It gives me a great pleasure to welcome you all for this academic session. This is dedicated to one of the most important topics, that is how to present a research paper, mistakes to avoid. In the journey of a surgeon, learning operative skills is essential, but contributing to the scientific community through research and publications is also equally important. And the research sharpens our thinking, improves our clinical judgment, and allows our experiences to benefit a much larger community of patients and professionals. But however, many young surgeons do find it very difficult to write a research paper or to present it. And today's topic is mainly focused on presentation. And the questions like how I begin this presentation and what are the common mistakes that lead to unsatisfactory presentation will all be taken care of here. And these are the genuine concerns of most of the people. And to all the postgraduates, I would say that today's session has been designed precisely with that objective to guide our postgraduate students and young surgeons on the art and science of presenting a research paper. This is the beginning of your journey as a surgeon with greater talent, not only to operate, but to speak in front of a larger audience. Every clinical observation, every unusual case, and every question that arises during patient care can be the beginning of a meaningful research. And I would say that whatever may be your topic of thesis or a paper presentation, do it with sincerity and with guidance from today's speakers. Your work and presentation can get highlighted. We are fortunate to have with us two eminent speakers, Dr. Ramakrishna HK and Dr. K. Lakshman, who bring with them vast experience in research, publications, and academic mentoring. And their insights will not only help us understand how to present a research paper, but also highlight the common pitfalls that many of us unknowingly make. I would like to appreciate the presence of all the heads of the department of various medical colleges in Department of Surgery, and your encouragement and mentorship play a crucial role in nurturing the students. And I would also let us make the most of this opportunity to learn from our experts today. I encourage everyone to participate actively, ask questions, and take back valuable insights. And with these words, I would once again say thank you to all our speakers and all the participants today. And I would request Dr. Sarvesha Raje Urs to continue the rest of the program. Thank you. Thank you.
Yeah, thank you, madam.
Yeah.
Yeah, today's program will start it now. I request Dr. Rajshekar Jaka to moderate the program. And our speakers, eminent speakers are there, well goes through these things. And many things they have done, and we have listened to them also. We'll be getting new things also. Go to Dr. Rajshekar Jaka, please.
Yeah, thank you very much. I don't think I need to introduce the eminent speakers of today's session, Lakshman sir and Ramakrishna sir. Both of them have been doing the research and teaching everyone regarding that. They are very enthusiastic and very systematic. When I asked sir, he gave me the list of preparations he had done. So that itself speaks a volume. So I don't want to waste the time. Let us concentrate on the real topic. So I request Lakshman sir to take over and start the session.
Good evening. I presume I'm heard and that you can see my slides.
Yes.
Yeah.
Yes, sir.
Good evening, ladies and gentlemen. First of all, a big thank you to our chairperson Naaz madam and the EC of the state chapter for giving me and Dr. Ramakrishna this unique opportunity. This is a subject, as madam very rightly said in her introduction, which is of great importance. I think as surgeons, we not only learn the art and science of surgery, learn the art and science of actually operating, but communication is an equally important aspect of a surgeon's life. And communication through a formal presentation will actually show up your work, not showing off, but showing up your work in such a way that it helps people and it helps your growth as well. And so in various fora, as an 8-minute podium presentation in a conference, an oration, which may be half an hour, 45 minutes, or it may be an educational program for lay public, wherever we will need a presentation. And so in the first part of our evening's deliberations today, I'll be talking about planning the talk, and Dr. Ramakrishna will cover about how to reach a higher level of your presentation, and more importantly, the mistakes to be avoided. Now, as I said, I would be looking at the planning of the talk, and the main aspects of planning are these three. The planning the content is important. As Rajshekar mentioned, even when we were preparing for this, myself and Ramakrishna, we sat together and planned who should say what. And that is planning the content. Once you do that, once you know what you're going to convey, you prepare the slides. And there are some absolutely clear-cut rules and criteria that you use to preparing the slides. And then you have to prepare the presentation itself. After you make the slides for the presentation, you have to spend time and prepare the presentation itself. And then your planning is complete, and then you deliver your presentation. If you're looking at planning the presentation, the primary role of any presentation is to grab somebody's attention. Please understand that the attention should be on you as a speaker and not on all the adjuncts. The slides are just adjuncts, and you must be the center of that presentation. You have to give messages. That is the very purpose of the presentation. And you do things to help the audience retain those messages. And the common method of helping people retain messages is to repeat the important messages. Please note that giving a good presentation is not a natural gift. If somebody gives a good presentation and they breeze through it and you're very impressed, hey, how nicely this person spoke, don't think that it is some kind of a God-given gift to that person. You can rest assured that that person would have spent a lot of time and effort in preparing for that presentation. It's both an art and science. It is something that can be learned, and it can be honed and improved by practice and diligence. Again, I repeat what I said, and that is the purpose of a presentation. This is a point I'm going to make, and so I'm repeating it. As I mentioned earlier, good presentations don't just happen. They're actually planned and executed. Please note that nothing can make up for lack of content. You may have a very fancy computer presentation, great graphics, great lighting, great this, great that. But if you do not have good messages that have to be given, the presentation will fall flat. There must be a logical sequence for what you say. You have a sequence in this presentation itself. I told you how the sequence is that first we plan the talk, then we plan the slides, and then you execute the talk. Already there is a sequence there, and that storyboard sequence is very important. Setting the tone essentially means you got to know who your audience is. You may have the same slides, the same subject, but when your audience are predominantly postgraduate students, it's a one type of presentation. That's the tone. If you're talking to the nurses, for example, it will be a different one. If you're talking the same subject to lay people, okay, you go to Rotary Club or Lions Club or somewhere and give a talk. It may be the same subject, but the tone is different. And at some stage, you have to involve the audience. It may not be possible on a regular basis in a webinar like this, but even here, always when I teach for an hour, for example, elsewhere in our classes, I always stop and ask for comments and questions. That's one way of audience involvement. The other better way, in fact, is to convert your presentation into a discussion. So you ask the question first, ask for answers, the audience give you the answers, and you give your own answer, backed by evidence, of course. So there are various ways in which you can involve an audience, but the principle is that you involve the audience. Malcolm Knowles is the father of the adult education principles, andragogy as it's called. He's the one who laid out how adults learn, and he made a very important statement to say that good presentations are a partnership where there is equal involvement, if not more involvement, from the audience as much as the presenter. Agreed that this is not a phenomenon for an 8-minute presentation for a postgraduate in a conference. That involvement comes in the question and answer session, but by and large, I'm sort of covering it for various kinds of presentations. So if you're in a class teaching people, then it means that you have to think of it as a partnership and a discussion rather than a monologue. We must learn from advertising in this. You can see in your IPL match, between overs, you have a 15-second advertisement slot. They spend lakhs or crores on it. And within that 15 seconds, the advertiser has to give you a message. He does it very effectively, as we have all seen. Various kinds of products are sold, and they even make you waste money on these products. Very easily done because of their excellent skill. We have generally a minimum of 8 minutes, many times 20, many times 15, many times 30, 45 minutes. So we should not hesitate to have the confidence to say that in that time we will be able to give messages. You have to define the messages, restrict them to 4 or 5 points. The 20-point program is for politicians. For you and me as professionals, it's only 4 to 5 points. And as I mentioned earlier, you must have a storyboard sequence. There must be a beginning, a middle, and an end. And give a summary first. As you saw in this presentation itself, I had given you a slide in the beginning saying plan. So I told you what I would do. I would give you the presentations, planning the talk. As I'm planning the talk now, as I progress, I'll talk about the design of slides and finally preparation for the presentation. So in your subconscious mind, this is the science of presentations I'm talking about. In your subconscious mind, you are actually looking forward, without even knowing it, you're looking forward to my next phase of this presentation. That is audience involvement. That is grabbing attention. So you have to do it in such a way. And as I said, if you want to give an important message, repeat it several times, subtly, not in a very jarring manner or a very obvious manner. But I already told you that several times, you must have noticed in this presentation, already said what my plan is and how you grab somebody's attention. 3, 4 times I already mentioned it. So that is the way you factor in this repetition of messages. Always take note of the time allotted. Okay, if you, as a rule of thumb, you can have 1 minute per slide. So if somebody says you can have a 20-minute talk, you can have about 20 slides, maybe 25. Exceptions don't include the title slide and the thank you slide. They just breeze through them. Sometimes you may have a lot of pictures saying the same point, so you breeze through them. So you may have maybe 30 slides for a 20-minute presentation. But I have organized conferences in the past when I find that somebody who's given 10 minutes to talk comes with 85 slides in their presentation, I really collapse. I really get worried about it, because you know that person is not going to stick to time. Sticking to time is an essential part of a good presentation. Please remember that you have to stick to your time, and I hope I stick to my time this time. And I have taken enough care, and I hope my theory works in practice as well. If you have a lot of information to give, use tables and graphics to reduce the number of slides. And in those tables or graphics, you can highlight areas where you want to grab the patient's attention or direct their attention. So they may have a large table. It should not be there at all in the first place. But if it is there, then you can always highlight some part of it to show that the audience have to look at that aspect of this large table or slide. Designing the slide is a good science by itself. Nobody really looks at, when you do a PowerPoint presentation, nobody really looks at what are the things that you're looking at. You get a template, PowerPoint gives it to you, you put some material on it, put some text, put some pictures, and the job is done. That is a very casual and I believe an incorrect way of doing it. You must spend time on designing your slide. These are the aspects of a slide that you must think of. There's a template, you have to think about fonts, you have to think about graphics, the color scheme, the transitions, the build effects, and sound effects. Sound effects, I don't think have a place in scientific presentations, okay? The only way is if you have a video with a voiceover, you could use that, but otherwise I would recommend that you do not use any sounds in your presentation, and I won't talk more about it, but we will talk about the rest of it. The template must be sedate and appropriate, right? It's important that you have either a dark background and a light font, as I have here. Others, you might equally correctly, you may use a light background and a dark lettering. There must be enough contrast. That is the important thing. Design, if any, must be subtle. You can see in this background itself that there is a little there's a little variation from blue to black, and there are small subtle suggestions of some rectangles in the background. And fonts must be appropriate for the hall. I'll just go back one slide and describe what this serif and sans serif fonts are. It's important. On an average, you use at least 28 to 44 point size of your fonts, and a serif font, this is Times New Roman. You can see, if you can see my pointer, that all these edges have a little spur on it. A serif font is like that, and that is usually Times New Roman is a classic example. That is better on a print. But on a slide, on a PowerPoint presentation, you must use what's called sans serif. This is sans serif. There is no spur in the end. These are all blunt corners of all these edges. All the fonts will be like that. And they are, Calibri. This is Calibri. The other one I have used here in this presentation is Arial, rounded, empty, bold. These are all sans serif fonts. And they are the ones that are recommended for PowerPoint presentations. And coming back to the size, you must know if it's a large hall and a large number of people, your font size must be very big. If it's an intimate gathering of 20 people, you can have smaller fonts. It's a small hall. Highlights should be subtle, and you can use either underlining, use italics, bold letters, or use larger fonts, or even shading. All these are good ways of highlighting what you want to show. Use bulleted points. Do not use, a lot of people copy paste paragraphs, or they write long paragraphs and read it. That is something you should never do. The audience reads the slide much faster than you do, and you have lost their attention. And as I said, the important thing is to keep their attention on you. So you have little bulleted points like this, which give you the cue, the hint to say what you want to say. So they're listening to you. They may see the slide, maybe absorb the bulleted points a little bit, but then they still don't have all the information. You are giving them the information as a speaker, and their attention is on you. And that is the purpose of a good presentation. And if you think you're in the beginning stages, you do not have the confidence to say what you want to say, PowerPoint has the excellent facility of notes in the, that goes with each one of those slides, and you can put the detailed thing on the notes and read it. I would not recommend it. I think with practice, you can work without notes. But if in the beginning stages, if you really need it, you can use the notes. And using the rule of 6 is something very important. Very simple. 6 lines to a slide and 6 words to a line. I repeat, 6 lines to a slide and 6 words to a line. That's all the material, text material that you should have on your slide. Anything beyond that will not look right. Okay, you must use photos and videos liberally. It reduces the size of your text and then again, you're explaining those videos, you're explaining those pictures, and that helps in keeping the audience's attention. Remember, when you're using photos and things, copyright information is important, copyright laws are important, and so you must make sure that you have covered yourself on that aspect. The colors to avoid are very important. I put them in the colors that are there. Pink, red, and light green lettering absolutely has no place in PowerPoint. Good PowerPoint presentations. They're really jarring, and science has shown that that's not something that the audience take lightly or take with any equanimity. They really find it a little jarring. Okay, transitions are the way one slide moves to another. You really don't need in scientific presentations, neither these transitions nor the build effects. Build effects are the way each component of a slide comes onto the slide. Neither of them is really very important. If you saw in the first few slides, I didn't have any transitions. I didn't have any build effects. The slide just moved one after another. But if you wanted to make it a little more spicy, a little more interesting, you can use transitions. Okay, but if you have build effects on a given slide, do not use transitions. A combination of transitions and build effects will make it quite uncomfortable. And again, the audience's attention is distracted by all these fancy things happening on the screen. And distraction is something you should avoid. They must have one focus, and that one focus is you, the speaker, the presenter. That is something you should never forget. Use only subtle transition, if at all. And if you look at PowerPoint presentations, there are what are called exciting and dynamic transitions. Do not use them at all. You can see when you look for transitions, you have subtle transitions, you have exciting transitions, and you have dynamic content. Don't use the latter two. If at all, use something which is none is probably the best, or you can use something which is very subtle. Look at this. All right. That is something that PowerPoint can do. I put it up just to show you that don't ever do such things. Don't do that either. Such a jarring thing on the eyes. Not at all nice. So do not use these fancy transitions, but go for very subtle ones like a wipe or some kind of a move up or move down or something like that. But even if you don't have any, it doesn't matter at all. Build effects, as I said, is the way one slide goes on to the next. You can use highlights of various descriptions that I mentioned about, like a bold or italics or whatever, but you can make the little other things come in as well. But again, you have a lot of fancy things, you have both on entrance, emphasis, and exit, and even more entrance effects if you go into PowerPoint. Lots of things are given. Do not use any of those fancy things. Look at this. Like some lettering coming on your slide like that, very jarring. This, no good. This, no good. This is probably the worst of the lot. Okay, such build effects have no role in a scientific presentation. My last part is preparing for the presentation. And once you have planned it, you have executed your slides, you've done everything, preparation is important. And my mantra for preparation is rehearse, rehearse, and rehearse. The less experienced you are, the more rehearsals you need. Okay, more for diction, the way you talk. Time, extremely important. Stand in front of a mirror, have a timer on your phone, for example. And I have a timer on my, right now in front of me in my phone. So as you time it, and you can even record it in your PowerPoint presentation, play it back for yourself. Okay, do it with your friends, even do it with your seniors. In Sagar, for example, when we give our monthly presentations, the students would have rehearsed it in front of us seniors at least 10 times before they go and present it in front of the audience. And they always do well. They never falter in even big, in big auditoria and in front of big audiences. Why? They have really spent a lot of time in rehearsing. That's very, very important. Note that the fonts that you have used in your computer may not be present in the computer where you're presenting it in the conference hall, for example, or in another college auditorium. So you have to save the fonts along with your presentation. And it's a very simple thing to do. This is a screen grab of how you can record your PowerPoint presentation. And this is the screen grab of how you can save your presentation with the fonts. So you can say save as. When you do that, it will give you here in the right lower corner, when you press on the thing tools, it says save options. Okay, you go in there and then you can say embed fonts in the file. Embed all characters, best for editing. Okay, so when you do that, all the fonts that you have used are also saved along with your presentation. And when you go to the preview room and see your slides in the presenters or that halls or conferences computer, if you find that there is some mismatch, there won't be because you have saved the fonts, but if there is still a mismatch, you can actually edit your slides then and there in 5 minutes to get the proper formatting. So to end, I put this excellent quote from Mark Twain, that it usually takes more than 3 weeks to prepare a good so-called impromptu speech. And that is the take-home message. The mantra is very simple. Get your content organized, spend time on planning and designing your slides, and rehearse, and do more rehearsals so that you have a good presentation. Thank you very much.
Thank you, sir. Thank you so much. So we had a very good insight. I'll be adding few more points, but as sir has divided, I think even Dr. Ramakrishna will be giving a lot of insights. So together we will first learn from this, and then we will discuss. As of now, we don't have any doubts in the charts. So after this presentation, we will discuss again, sir. So over to Dr. Ramakrishna, HK. Sir, over to you.
Before Ramakrishna starts, if I may, it is designed in such a way that there will be 20 minutes for discussion, so that we would very much invite comments from all the other seniors here, critique and improvements, if any, on what we have said, and above all, questions and comments from our postgraduates as well. Thank you. Ramakrishna, over to you, sir.
Sir, am I audible, sir? Am I
Yes,
audible?
you are. Yes. Slides are seen as well. Yeah.
Good evening, everyone. I thank KSC-ASI for this opportunity. In next 22 minutes, we shall discuss how to win an award in the award paper session and the mistakes to be avoided. This is especially keeping in mind, I have prepared keeping in mind PGs. I have prepared especially for this award paper session. I have taken several paper submissions in the previous KSC-ASI cons here to highlight some of the mistakes. It's not to find faults with the guide or the student, but it is only for education purpose and to improve for the next presentation. At the outset, I must tell you, nothing can compensate for poor content. This Dr. Lakshman has already highlighted. I will be just stressing it again. So the essential thing is you must have a good design of the study and good contents to win an award. Without that, it is impossible. So for you, it is inevitable to learn the research methodology. And with that knowledge, you can have good design of the study and good contents, and that really wins the award. I have been judged for various award sessions in the conferences and also peer reviewer for IJS. So whatever little experience I have, I wish to share in next few minutes. The process is the KSC-ASI employs 3 judges who sit independently amongst audience, and they'll be having a score sheet. They'll be scoring each presentation under 10 heads. And at the end, scores of all the 3 judges will be added, and whoever gets the highest will get the award. This is the scoring sheet we have used in the recent KSC-ASI con at Raichur. Please note here, there is various heads starting from title, then objectives, methodology, originality, and up to time management and how the student responds to the questions by the judges and the audience. So each heading will be having 10 marks, and the marks will be allotted by judges independently. Please note there is no weightage for author, guide, or the institution. And more importantly, some students think that if they present cases with complex surgeries like Whipple surgery, renaissance, or liver transplantation, they will win an award. It's wrong. Actually, what we give importance is the methodology, whether it is correct, how he has prepared this study, whether everything is incongruent with the methodology basics. All these things will count. Sometimes a simple study, as simple as putting an IV cannula, if it is done properly, it can win a prize compared to a Whipple surgery presentation without much research, without important research question or methodology. So this one must realize. It's not the magnitude or the complexity of the surgery, but it is the methodology of your study which wins you the award. You must pay attention to the starting from the title. You must pay attention to the title. The title must be concise, descriptive, and by looking at the title, the audience should know what can be expected from this study or project, what knowledge they will gain at the end of this presentation. Though it looks concise and descriptive, they are contradictory to each other, but in reality, they are not. Look at this title. It is concise because it has got only a few words. At the same time, it is descriptive. It has described how, what type of study it is. It's an RCT. What are the interventions? What is the study subject, rectal cancer? All these things are there in this title. So it is a concise and descriptive study. And by looking at it, I will know at the end of the presentation which one, whether laparoscopic or robotic is the better one, or there is no difference between them. Both are same. So this is the knowledge I'm going to get. So the title should be something like this. Please avoid funny, fancy titles. Believe me, these are not my imaginations. These are the real titles I got in the previous KSC-ASI concept paper session, especially the award paper session and others. Even free paper sessions also I have taken some of these things. And this doesn't give any insight into the presentation. Please avoid this. Also, in the title itself, if you use a wrong thing, it will carry very bad impression by the judges on the presentation. Use correct terminologies and some of the things which are well established, like prophylactic antibiotics in pancreatitis. It is a concurrent dump, but everybody knows what it is. Level 1 evidence is already there. So not much interesting topic. The audience will lose interest in such things. So avoid these things. And some good titles also we had in our KSC-ASI papers. These are some of the things I have picked up from the previously submitted papers. Please avoid the institution name in the title. This is one thing is because it can introduce bias. Please remember, bias can be negative also. And the conclusion what you give at the end is not applicable to only that particular hospital. It should be extrapolatable to other hospitals in general. So avoid the hospital name in the title. Any journal article, if you read, they follow this IMRAD format. So for presentation also, you should use the same thing. We shall take up each heading a little bit. In the introduction, I have seen introduction something like this. Please remember, introduction is not self-introduction of the author. It is the introduction to the topic. What it should contain? It should contain the rationale, the background information. So we have to quote some of the papers, information from the already published articles, and identify what is the gap in the current knowledge. This current gap in the current knowledge becomes the research question, and how your study is going to bridge that gap. And when you give final conclusion, how that conclusion is going to improve the current surgical practice, means the clinical relevance of the conclusion. These things you must tell in the introduction. That will justify your study. But do not waste time much in introduction or the historical aspects. If you keep on telling so many things which are not required, you will have so many information which you have to tell, but you will not have time to tell it. Many students, they keep on telling the historical aspects in the initial slides. It is waste of time. Please don't do that. And introduction also. They start with, I am Dr. So-and-so, bringing greetings from my institution. Then they will show a beautiful photograph. Then my topic is, I am under guidance. See, all these things, it will waste about 30 to 60 seconds of your time. Almost 10% of the time allotted for you in the award paper session. Don't do this. Directly attack the topic. Don't give too lengthy introduction. Most of the sentences here are useless. They are not giving any particular information because the audience are all knowledgeable surgeons. They all already know about the disease. So don't give that. What I told you initially, you should give background information, the gap in the current knowledge, and how your study is going to fill that gap. That's all you have to tell in the introduction. At the same time, introduction should not be too short also. See, he has put only one sentence and started with methodology. There is no useful information in this. This is also wrong thing. Avoid videos unless it is a video session. See, research paper, you must stress more on the data analysis and your conclusion. Videos are most of the time unnecessary. See, one paper I saw, it was comparison between TAP and TEP. Then he started showing one TAP procedure 1 minute and then TEP procedure 1 minute. This is real time waste because these things are not required when you are comparing those two. What you should give is what is the complication rate, what is the outcome, how it differs. All those things you must tell, not these videos. And next is the project data. This is the most important part. You must tell the methodology, how you have managed data, and especially the patients and methods. All these headings, it must be very clearly defined there. I cannot go into details of each and every one because this itself will take one talk. But I stress this is the most important part of your presentation. This gives the maximum impression on the judges. They will be judging the paper based on this most of the time. Don't use future tense here. He is telling it will be categorized, it will be tabulated. This mistakes happens because most probably this PG has copy pasted the protocol directly without even understanding what it is. See, study is already done, so you must use past tense. In protocol, study is yet to be done, so you will be using the future tense. And the study's design should be appropriate to the research question. See, for example, in this, he's trying to study a particular scoring system in diagnosing the acute appendicitis, and he has designed a retrospective descriptive study. He has a patient's sample size is 135, and he has taken case papers. And 3 different types of scoring systems are compared here. It is very, very unlikely that all these previously written case sheets of 135 patients will have all the data points which are required to calculate these 3 different types of scoring system. So integrity is questionable here. This is another example. He's trying to find the efficacy of a particular procedure, but he has designed a cross-sectional study. Again, wrong thing. Cross-sectional studies are designed to find the prevalence of a disease, not efficacy. For finding efficacy, you must calculate what is the sensitivity and specificity of these subjects. So wrong design will get you down there. And while presenting the results, you can use tables and graphs. Either you present in the graph or in the table. Both are appropriate, but don't use both together. Same data, if you repeat in table as well as the graph, it is again waste of time and testing the patience of the audience. And while showing the results, you must show the actual data, the raw data, what you have got from your study, not a conclusion like statement, something like this. It was found significant at 0.05. This is almost a conclusion after analysis. Don't show this. The result should show the actual data, something like this, a table or maybe a graph. The moment you look at it, you can infer which group is better with what is the p-value, all these things. So this is how you should present a result. And while mentioning the conclusion, again, you must remember the introduction and initial aim of the study. It should agree with the conclusion. So it should be in accordance with that. And here you see the discrepancy. The study is on the factors influencing the ulcer healing by a particular intervention, that is VAC. And in the results, he has shown what is the time taken for the ulcer to heal. And when it comes to conclusion, he is mentioning the reduced duration of hospital stay, reduced complication rate, the cost of the treatment. See, in the result section, he has not mentioned anything about the hospital stay, no cost analysis, no infection rate, and conclusion, all these things will come up. This is very wrong thing. Please don't do this. There are several myths among the students. They think more the number of conclusion, better is the study. They think if you give more conclusions, the chance of getting award is better. It's wrong. The fact is that a single conclusion backed by strong data is far, far better than many conclusions with little or no data. Another myth is that the study should always give the positive results. Again, wrong. If you read any of the recent journals, many articles would have been published there where negative results have been given. So negative results are as important as positive results. And most common mistake I have observed in these presentations of PG paper award is statements of other studies. It will be mentioned in the study as if it is their conclusion. Please don't do that. Conclusion should be based solely on the data presented in the paper. It should be your data. The paper, it may be true. It has a less hospital stay, less pain. All these things may be true, but you have not given data, so don't give all this conclusion in your paper. Those can figure in the discussion. That's okay, not for the conclusion. And after preparing the slides, you just go through it, look at the presentation and look for the questions. What are the possible questions you may expect from the audience or the judges? Sometimes, as Dr. Lakshman also stressing, present it to your friends and teachers, request them to ask questions, form questions, and be prepared with that. There should not be any word in the PowerPoint presentation, the meaning of which you do not know. Sometimes they show something like, they say KM graph, but if I ask what is KM graph, he's blank, he doesn't answer. So whatever words come in the presentation, study it, be prepared with the answer, know the meaning well. And while answering the questions, listen to the question completely and carefully. Don't interrupt the judges in between the questions and you start answering. Don't do that. And if you don't understand the question, gently request them to repeat it. Or if you want clarification, you can ask for it. They will be clarifying what exactly they want. And while answering, answer concisely. Don't beat around the bush. You start with something else. They would have asked some question and you started with something else. And by the time you come to the proper answer, time is over. And if you don't know the answer, just admit it. Admit it. Say, I don't know, sir. Then he will ask one more question so that you will get better marks in that question. And prospect of carrying better score is there. And never become defensive. If you become defensive, you will be committing more mistakes. My professor, Dr. Lakshmi used to tell, if you call donkey a horse, you are not committing one mistake, you are committing two mistakes. You don't know what is donkey, neither you know what is horse. There are some miscellaneous things I wish to highlight here. And this slide I had prepared about 20 years back to show how to insert a video clipping in as recent a conference as Raichur. I have seen many authors, they were unable to open the videos from their PowerPoint. The mistake sometimes it could be because of they have copied only shortcut, which doesn't really work. And what I do or advise you, you create a folder on the desktop, put all the related files, not only PowerPoint file, but all the files like video files, everything in this folder. And while copying, copy the whole folder, not just PowerPoint file. Copy whole folder to your pen drive or whatever, put it in the conference hall, then this video will work. And it's a good idea to always preview at the venue after you have downloaded your presentation in the preview room. See that this video works by going to the particular slide and see, and you must always have backup copy of all the related files like videos and all. Nowadays it is very easy to carry, either pen drive or cloud or even G drive, everything is available. The next few slides are essentially the repetition of what Dr. Lakshman has already highlighted. I just want to show one slide each on this. And avoid irrelevant photos. Your data is very good, but the moment you put a picture like this, audience concentration invariably goes on the picture, not on your data. Please avoid this. Unnecessary animation, again, you must avoid. These are really irritating things. These sounds also, unnecessary sounds also, you must avoid. They think that something is better than nothing. They try to compensate poor contents with these graphics, sounds, and these things. But please remember, nothing is better than nonsense. This is not a cinema, this is a scientific presentation. So you should be presenting only science, not these things. Please pay attention to the spelling mistakes. In many slides of the presentations, I have seen mistakes, and these type of spelling mistakes, even computer spell check also will be failing to detect. And never complain time was insufficient. See, this author has only few lines to deliver the message, and he's been doing very successfully over years. And as Dr. Lakshman said, you should see the TV advertisements. Always finish within time allotted, or you will lose 10% of your marks. You should always leave the audience wanting for one more slide, not one slide less. Small size fonts, complete sentences, you'll end up reading the slide rather than explaining. Avoid this. And too many lines. This is also to be avoided because nobody is bothered to read all these lines. This background and font color, it should be opposite, not the same thing. It will be straining to the eyes. Just I am re-stressing whatever already told. Always target to the talk. Don't beat around the bush. If you are given one particular topic, directly attack that topic. Tell something about the topic and keep on moving. Don't tell anything other than the, and that means irrelevant things there. You'll be wasting time. And it is imperative for you to learn the research methodology. You should learn, understand, and discussions in the various journal clubs and all. It will be very helpful for you so that your concepts will be better and you will be designing better studies and avoid many mistakes in the methodology. And you take the guidance of your teachers, guides, and scientific committee of KSC-ASI is always there to help you. And KSC-ASI and other websites are there which will be helping you to give many information regarding this research methodology information. See, KSC-ASI has also has published one small booklet on evidence-based surgery and research methodology. This is available for free download in PDF form. Please download and read it. It is a very small one. It will give very basic information. To repeat whatever I have told, you should design a good quality study, conduct a good quality study, and have good contents. This is first and foremost requirement. Rest of the things are relatively easy. By practice, you can develop and improve it. Prepare the PowerPoint presentation well. As Dr. Lakshman told, all those things you follow, prepare it, rehearse it repeatedly. Repeatedly, you have to rehearse at least 10 times and see that you will finish within the time allotted. And definitely, you all can win a prize. Best of luck. Thank you.
Thank you so much, sir. Ramakrishna sir, it was a very informative session. Um, I think there are a few questions asked in the chat box also, though they are answered over here. But let me ask it. AI, yeah, as usual, AI is now supporting in preparation of PPT. What is your opinion in using AI? Uh,
Sir, it can be used. It can be used as an aid, but it should not replace you completely because it's not a correct way. And many people they use it, but it can be detected also. Sometimes wrong information is also there, so it is better to use it. First, you create your presentation, and then you try to use it to improve your presentation, not to completely replace your presentation.
should we put a disclaimer that we have used AI?
Better, sir. For what I have used, that much you can put. Because even the journals also nowadays asking for it. You must disclose to what extent you have used the AI.
Fine, sir. And Tanga sir has asked few questions. Can the speakers elaborate something more than supportive? And if time permits, role of AI in paper publication, reviewer, and journal policy.
If I can take it, AI should never replace your natural intelligence in any research or publication activity. That's what I think we all mean when we say it must be supportive. If you have a full paper, for example, and you would like a PowerPoint presentation of that paper, you should prepare one yourself first to the best of your ability, and then load the whole paper up onto the AI platform and say, can you suggest a PPT for this? It will give you the outline of a PPT. You can compare that with what you have. And if you find that there is an improvement on what you have done, then you can use it. But more often than not, I've done this exercise for the sake of an exercise. More often than not, it will not give you any great improvements, which means that you have used your natural intelligence to do what you need to do. That's the important thing. Where it helps you is in saving time. For example, I've used it, this is for publication, not presentations. I've used it, I put up my whole paper onto the AI platform and said, give me an abstract of 250 words. It gives you an abstract within about 3 minutes, 2 minutes or something, very, very quickly. If I hadn't used that, I would have probably spent 45 minutes writing the abstract myself. And so I use AI for that kind of facility. But please note, even in that situation, I will write one myself and compare the two and see what is good. I will not blindly follow AI for the simple reason that AI is known for its so-called AI hallucination. It never says, I don't know something. It will concoct something, as Ramakrishna said, and actually give you incorrect information. And AI's information is not based on peer-reviewed articles, like all our publications should be. So somebody writes some nonsense, AI gets a summary of that and includes it into your so-called evidence-based presentation. And that's a huge drawback, which makes me avoid AI completely. I use AI basically to be in the know of what is happening. I don't want to be left out. Okay, FOMO, as they call it, fear of missing out. But I don't depend on it to do any of my academic work.
Sir,
Sometimes
to add to that, yes,
it
please, yes.
it can be used to polish our sentences. Sometimes we make so many mistakes in writing, the spelling and grammar mistakes. So those
Grammatical
things,
errors.
yes, so those things AI will do very well.
Yes, I totally agree because AI will definitely help. I have seen, as sir said, abstract preparation and grammatical mistakes and some letter, when editor letter you need to write. Within seconds, it will give you. But definitely the core data, you have to have the original data. Then definitely we can use AI to refine it. So that is one thing. And there is a question using capital letters. Shuram sir has asked entire presentation on capital letters. Definitely, it is so difficult to read. So, what is your take on that, sir?
Not to be done at all. Completely 100% agree with Shivram. Don't use capital letters at all. If at all you use it, it must be only in the title of the slide. But the main content, the main text of the slide should be in the lowercase.
Only highlight certain things we can use
Highlights can be
capitals.
capitals. Yeah.
Yes, sir.
They can actually, whenever there is an important thing, they can a little bit change the color or change the font size so that it is more visible, easily
Correct.
catchy. So that is how it can be. And sir, what do you suggest? Sometimes they are so crowded, slides are so crowded, and they just keep reading the line by line. It is just uh, whatever is put on the slide is for your this one. They have to take some tips and over that, and they have to speak spontaneously. Instead of that, they keep on reading. They copy paste from the books. So how many sentences do you suggest in each slide, sir? Because
Yeah,
most
rule
of
of
the
six,
times,
as I mentioned. Yeah,
yeah,
rule of
yes,
six that I mentioned.
yes,
6 lines
yes.
to a slide and 6 words to a line. Not more than that.
Fine, sir. And at the end of each presentation, as you said, we need a critic before we come and present over there. So otherwise, suddenly what happens? Someone asks a question and they don't know what to answer. So if they have practiced this and if they are ready to take questions before they really come on the podium, then definitely they are better prepared. So that
This is a
really
routine practice, as I mentioned in the Sagar group, for example. Our PGs prepare their presentation for the monthly meeting, which usually held in July in Bangalore, SSB. Before they go onto the podium, they would have had at least 10 times presentation in front of all of us, the whole group and the seniors and the teachers. We critique their presentation, we critique their data, we critique their slide design and prepare them for questions. We ask questions, but that is an area where we are least successful, because all of us imagine that somebody would ask some questions. These guys are prepared, and when they go on the stage, somebody asks something else and they are flummoxed. Okay, that's one area where we cannot guess what others ask, but by and large, we put them through that exercise.
Sir, even the audience also should be educated, sir. So the study would have been on one particular topic, and the audience, they keep on asking something else, and they will add their own experience, their opinion. These things should be discouraged. For a lecture, it's okay, not for this award paper session, sir. So that will waste time, and we cannot ask proper questions to the PGs because the 2 minutes is over. And I think Dr. Srinivas Pai has highlighted that 2 minutes, and it's very long questions. They just wind up without answering it. So it is difficult to assess the presenter for the judges without asking questions. So the chairpersons, they should be able to control these things. The questions should be relevant and only questions, not compliments or their adding their experience. These things should be avoided in the award sessions, especially.
I think the moderator or the chairperson should step in and say this is not relevant to the study, because
Yes, sir.
student may not be able to tell that. And one question to Dr. Ramakrishna is, I have seen you asking this question: efficacy in the research title versus accuracy in research title. When to use these terms and how to link the title to the conclusion?
Sir,
Sir,
efficacy is the sensitivity and specificity. Means the how the particular, if it is diagnostic, how it is able to diagnose the particular disease. That is the one thing. So the other thing, what you asked, sir?
Accuracy.
accuracy.
Accuracy
When you will
also.
use the efficacy and when you will use accuracy?
Accuracy is more or less same answer, but it is slightly different analysis. The negative predictive value and the positive predictive value, all those things will be considered in the accuracy. Efficacy means how it is efficacious in treating. If it is intervention, how it is able to treat the particular condition. If it is a diagnostic tool, how it is able to diagnose that particular condition. Sir, anything, sir, Dr. Lakshman, sir? Anything?
No, I think I would agree with that. These are different calculations of the outcomes.
Yes, I invite the audience. If they have any questions, they can directly ask it one by one. Yes, sir.
Yeah, Dr. Jaka,
Yes,
one
sir. Sriram
thing
sir.
I asked also, I think it's important to put the disclaimer slide in the beginning, because many times pharma company might have sponsored, research grant might have come. So that's one thing. What, Dr. Lakshman, what is your opinion?
I agree with that, but a disclaimer has to be there if there is a conflict of interest. But if there is no conflict of interest, using a routine disclaimer has not come into routine practice as yet in our country. And of course, we were in this context, we were talking about postgraduates and award papers and the like. So in that, the question of disclaimer doesn't come. But when you're giving talks, if there is some kind of sponsorship, if there is some kind of conflict of interest, either in your study or in the presentation that you're making, I think it's a requirement that you put a slide. You can call it declaration of conflict of interest, or you can call it a disclaimer. And that has to be there in the beginning of the presentation.
Right. Second thing about AI, it will be part of our life. And when we say AI, everybody thinks of ChatGPT. but there are many, many platforms which are so excellent. And whatever you want, whether you want video, PPT, research paper, anything they can produce. So we should not allow it to replace us. Actually, I'm doing a AI course through the National Board of Examination, and it's very, very revealing that, and also what the hallucinations is a very, very important topic, and how to give prompts. See, any of the AI tool will answer how you give your prompts, then only it will properly comes. So you have to give all the restrictions, what all should not be done, what to be done, everything in detail. Then only you'll get a proper answer and proper reply from that. Otherwise, it can go anywhere, haywire. So that's a very important thing, and also it can totally mislead, hallucinations.
Sir, journals nowadays, they check this also. There are softwares to check the usage of AI. It will
Yes.
show how much percentage of your content is created using AI. When our KSC-ASI comes in our paper session, we are not using it, so I didn't highlight on these things. But if you are submitting an article to journal, definitely they will check the AI. AI check is just like plagiarism check. AI check is also there.
Yes,
It can
yes.
pick up.
I
It can
agree.
pick up.
Recently, we published papers in BMJ. So there the disclaimer and consent was there that I have not used AI. And they say if you have used it, you have to specifically mention which part of the article you have used AI.
Yeah.
Yes, sir. Correct.
Ravi Shankar and Sangamesh had raised their hands, please.
Yeah. I think just to to emphasize the point that both Dr. Lakshman and Dr. Ramakrishna made. When I did the Narendra oration, I prepared the presentation myself completely and just sent it to my son for an AI check and then also to one of our medical oncologists for an AI check. It came back and said there are no corrections, just added a few this one citations and references. So the point is you have to make the effort, because otherwise you will go and just vomit whatever it has said. Unless you understand the topic, you will not be able to deliver a proper lecture that the audience can understand. So for you to educate others, you have to educate yourself first. So prepare the presentation yourself, then use the AI if you want for help, and don't take everything that it says as gospel truth.
And don't put your personal data in AI, because AI will absorb all data from Facebook, from Instagram, from your conversations, your WhatsApp chat, from everywhere. If you put your personal data, then you'll be in trouble later.
Correct.
Yes, there is a
Sangamesh had
question.
raised his hand.
There is a question. Ethical committee clearance, is ethical committee clearance required?
Yes, sir. For all studies, because I didn't highlight, I just showed one slide on patients and methods and the methodology protocol. Because our purpose of this presentation was something different, I didn't focus on that. Any study, definitely it will require ethical committee clearance, especially if it's a interventional study.
So I think
That's to publish, no, sir.
to add to
Should
that,
be
scientific committee clearance first, and then ethical committee clearance. Both should be taken if you want to present a paper properly.
Dr. Ramakrishna, sir.
Yes, sir.
Srinivas Pai here.
Sir, yes, sir.
So that ethical committee clearance, this time it cropped up for the conference papers. So when presenting in the conference a study, do you need the ethical clearance in
No,
the
sir.
award session?
Sir, if the study itself is already cleared by the ethical committee, I don't think we need one more clearance for presenting in the conference.
That is one. And about AI use in postgraduate students, I think we should discourage it till they become consultant. Like Dr. Ravi Shankar, sir, I heard his presentation there. I was there in the audience. It was excellent. You couldn't make out it was prepared by an AI because he's operating those cases. So he has a fair knowledge of what he's talking already. The AI has only helped him save time, but a student has to learn how to do it. If student uses AI to present a paper or prepare a paper, he bypasses that process, and he's totally, that AI becomes a crutch. We are facing this in the seminars and other things, not only in the awards. In the seminars they're doing it, and that is spilled over to the awards. That's why you're seeing all those crowded slides.
Judges will be able to pick it up, sir.
Yes,
If you
yes,
have used totally AI,
Yeah.
and if they ask one or two questions, if the PG is unable to answer whatever he has put in the PowerPoint, definitely we can make out it is something he
The
has
AI is more
taken
for
and he has not
training.
understood.
Yeah, the AI
Yeah.
is more for surgical training, simulation, and active feedback. That there it comes very good. Not for award and poster and giving talks for students, postgraduate students, sir.
Yes, sir.
For
Here
us, it
also,
is
as I
good.
said, it's
Yeah.
only for polishing your presentation. If you
Yes,
are
yes,
using it, is okay, not for contents.
yes, sir.
Yes. Any questions from the students, or chairman is asking?
Dr. Sangamesh has raised his hand.
Yes,
Yes, sir.
Dr. Sarvesh, please.
Yeah, good evening, sir. My question to Ramakrishna sir, sir. Sir, any
Yes.
specific instruction on presentation of statistics in our research paper? How much statistics should be there and what all should be there?
Sir, it depends on your study, means what type of study you have done. The statistics should be appropriate to that. First, you should give the raw data, then you should say what type of statistical test you are using. Sometimes just they keep on mentioning the things. I have done 50 Nissan's fundoplication, then 10 patients were like this, 6 were male, 6 were 8, and 1 complete. This is not a study at all. There is no proper research question there. In such paper presentation, statistics doesn't have much role except for telling you the mean, standard deviation, all those things. But if you are having two groups to compare them, it depends on the data. That itself will be a different class. But to summarize it, if it is a categorical data, you need the chi-square test or Fisher test. If it is a continuous variable, then you need student t-test, something like that. So the appropriate test must be used. You should mention what test you have done and tell what is the p-value. Then you should be able to conclude whether there is difference between these two groups or there is no difference. If there is difference, one will be better than the other. It is easy to analyze after that. But the main problem is what type of data you are dealing and what test is appropriate for that data. That you should know. And for that also, there are various softwares. Calculators are there, available easily online, and you can do it. Not a very difficult job.
Yes, I agree with you, sir. Most of the times, what happens, the aim will be different. The data will be something in halfway cooked, and
Yes,
conclusion
sir.
will be so many which are not
So,
relevant. So that is the most common mistake which is done. So I think we should avoid that. Any more questions, please?
ಹಲೋ ಕ್ಲಾಸಲ್ಲಿ ಇದ್ದೀನಿ ಏನು ಸಮಾಚಾರ
Sir, you can mute, I think.
ಅಲ್ಲಿ ಹಾಂ
Yeah, any more questions, please? Yeah, I think no more questions.
One question I have. It's part 2 of the question which I have already typed. This question, accuracy and efficacy difference, was asked by the judge to me when presenting a paper. What is the difference between accuracy and efficacy? I have asked the same question to the judge who asked me. I have returned the question to the judge who had asked me. Dr. Ramakrishna only asked me this. When I presented a award paper, what is the difference between accuracy and efficacy? So I really went to use what term, like for what study to use accuracy, for what, I think he made it clear, I think. But I thought that for a lab test and for a diagnostic test, when you're in the laboratory, I think you should use the word accuracy. Am I right, sir? When we're doing a clinical study, we should use the word efficacy.
efficacy, yes, sir. No,
Yes.
especially we are dealing with this sensitivity and specificity. And the other two things is positive predictive value, negative predictive value.
And
If you
I've seen
show
you
these
asking,
things,
yeah. Sorry.
that will highlight it.
Yeah, my second
If I
question
may-
was, I've seen you asking this question. Does your conclusion and your title, does it match? This is the commonest question you have asked many postgraduates. I've seen from the side always,
sir.
even this year. Yes. Could you tell us a little more, throw a little more light on that?
Sir, in the aims and objectives, they would have told something, and by the time they come to the conclusion, they will mention something else. See, for example, the aim, they say to compare TEP versus TAP, and in the end, when they come to conclusion, they will be keep on telling it is more hospital stay is less, infection rate is less, and in that paper it is written like those things they keep on telling. So when you are comparing, you should tell in what way you are comparing, whether it is recurrence rate or whether it is the pain or it is something else. That means the outcome, what you are going to measure, that you must specifically mention and give data on that. So while putting the conclusion, you must put conclusions only for which you have produced the data. If you have not done cost analysis, never conclude this is cost effective or cost of this treatment is less. Those things should not mention in the conclusion. If you are assessing only recurrence rate, should say this is better with respect to lesser recurrence rate. Like that, you should be concluding. And in the title, they would have mentioned measuring the efficacy. And in the end, while putting the conclusion, there is no word on the efficacy at all. They would have mentioned something else, less hospital stay or infection rate is less, like that. It doesn't agree with each other, sir. You should always keep in mind what is the topic, what is the primary aim and objective, what is the data you have produced, and based on that, you should give the conclusion.
And the third follow-up to that only, sir. If the abstract doesn't match, when we get the abstract for screening, if the title and the conclusion doesn't match, one, and there are no statistics, two, are we free to reject this paper from the award session?
Yes, sir, you can reject, or if our organization allows, we can send it back asking the specific questions, and if time allows. Most of the time, we will be dealing at the last moment and on the deadline, so we don't have much time. But if it is allowed, we can send it back to the student, ask specific questions, or present it in a better way. And improvise.
I have a comment on this. We've been trying for the last 25 years or more in the organization to raise the bar of presentations, particularly for award papers. And the constant answer I get, I'm not saying it is incorrect, but the constant answer I get is that if you keep the bar very high, then you'll have no participants. And that you must encourage people to present. So right now, we have been accepting all in sundry, anything that comes our way, and try to get the best of the lot. But I firmly believe that we must insist on certain minimum criteria for giving an award. And if in a given year you do not get papers which meet those criteria, give no award. And keep trying to educate the people. Ramakrishna and I and many others have been trying that. Keep trying to educate the people to produce good quality work and good quality papers. It's possible, but because we are keeping the bar very low, we are still getting, abstracts and papers which do not meet the basic requirements. That's my very humble submission.
Sir, many papers they submitted just enumerating the cases done. I have done 50 cases, 10 males, 10 females, like that annual report, like they just keep on mentioning those things. There is no analysis, there is no research question, no aims and objectives. Such papers they produce. Actually, they're just presentation, that's all. It's not a research paper at all. Such papers we are getting in our papers.
Correct. So yeah, to conclude, I think there was the very good insight given by both the eminent speakers, very experienced speakers. So I thank both of them from KSC-ASI. I think most of the doubts are cleared, and let us now pass it on to our team, the chairman and secretary, to take it from here. Thanks to both of you.
Thank you.
Yeah,
thank you, sir.
Yeah. Thank you, Jaka. I request Dr. Rajgopal Shane, Director, Academic Council, ASI, to to put his comments.
Thank you very much for giving this opportunity. Firstly, let me congratulate Dr. Naaz Madam and the entire team for arranging this wonderful presentation. And Dr. Lakshman and Dr. Ramakrishna, I don't think requires any further introduction about their, again, accuracy and efficacy. Remember, they are the one who have been working for the organization, as I know, for last more than 2 decades. Yes, every one of us work hard here for the improvement of the standards, but just to quickly to say that my talk in the Raichur conference was pitfalls. So there are hundreds of pitfalls in the presentations to slides to. We start from the admission process to the medical colleges to at every level, starting from the topics to everything. Yes, we all try to, every one of us will help for the improvement of the education part of it. I think that is where we, to certain level, we do compromise, including a time factor which has been mentioned, 8 minutes, 2 minutes, 3 minutes. Every minute becomes so important in the conferences for several reasons, which are not here for to speak. You know, the one who goes into that process will understand the deeper problems each one of us will face. That is irrespective of that wonderful session. And congratulations, keep the good work going for the benefit of every one of us. Thank you very much.
Thank you, sir. Good day. Good night.
Thank you. So thank you, Dr. Lakshman, sir, and Dr. Ramakrishna. It was an excellent session. And I just want to tell everyone that it was Ramakrishna who actually gave me some insights initially when I started my presentation journey. So I'm really indebted to him always, because it is he gave me so many hints at that time, and probably that is how. And one more thing, what he told me was rehearse, rehearse, and rehearse. I think that is a point to be taken by everybody. Rehearse alone, rehearse in front of the camera, and rehearse in front of your teachers and friends. I think this is how you should go about it. And the presentation, definitely the quality should be improving. And just to tell you all that one more session on AI is coming soon. So stay tuned to KSC-ASI and wait for that time. Very soon we are having a session on AI on our surgeon's time in KSC-ASI. And thank you all for participating. Thank you, Dr. Rajshekar Jaka, for a wonderful moderation. And for all those people who asked the questions, thank you so much for a good participation. Thank you and good night.
Thank you and good night.
Yeah.
Thank
One
thank
thing. Yeah, thank you all.